Thank you very much for detailed introduction, and thank you very much, Dr. Nagai, Dr. Fujioka, and Professor Kudo, to give me this opportunity. So today I'm going to talk about gait analysis with musculoskeletal diseases. So this research is supported by Hitachi High-Tech Corporation. So the number one reason to require nursing care in Japan is musculoskeletal diseases. So prevention of this disease condition is quite important because behavior change and physical activity can prevent this disease. It is desired to develop easy and practical system to predict musculoskeletal disorders. So we focused on the gait. Gait is a whole body movement consisting of highly coordinated voluntary and involuntary motions. And it reflects disease condition. And we also use gait assessment as a critical diagnostic clues of musculoskeletal disorders. But previous studies, people use mainly these two methods for gait analysis. One is just speed. This is quite easy, but a single parameter with low accuracy, and it's quite changeable. And another one is 3D motion analysis. This is very complicated, but provides multiple parameters with high accuracy, and it is so solid. But nowadays, as you know, recent technology developed motion capture technologies that could trace whole body movement without markers attached to a subject and provides numerous gait features. And also machine learning can predict over disease condition from numerous features. So we set a hypothesis that machine learning with numerous gait features generated from whole body movement during a gait can predict musculoskeletal disorders. This is a system we developed for gait shooting. So system consisting of a Kinect camera and a notebook type PC. Then you don't need markers attached to the body and no calibration, just one click, one gait, that's enough. This is a picture just before start. Then if subject feel ready to start, just start walking toward camera, then underneath camera, then done, very quick. Then Kinect can recognize 25 joint points, then provides you a 3D positional information. So this is a schema of 25 joint points. And this is a stick figure showing how a subject walk a single gait. Then we, because the 25 points, joint points, so you can generate 300 segments determined by 2 joint points. For instance, this is a segment determined by right shoulder and left angle. Then also those information has 3 axes of distance. Also 3 statistics we used. One is average, maximum, and minimum. So finally, we had a total of 2,700 features. So 300 segments, 3 axes, 3 statistics. So this is the outline of machine learning. We selected the top 20 gait features related to a disease condition. So we used 4 statistical methods like this. So we had 4 sets of 20 gait features. And we used 20 kinds of machine learning. So that means a total of 80 algorithms we used, 4 sets of gait features multiplied by 20 kinds of machine learning. then eventually we validated by 5-fold cross-validation. This is a list of machine learning we used. Then to evaluate how it works, we used 3 precision parameters. One is the AUC of ROC. The second one is Matthews correlation coefficient. And the last one is accuracy. If your data is unbalanced, this MCC is the most reliable parameter. So today I want to talk about the 2 disease conditions. One is lumbar spinal stenosis, LSS. This disease is lumbar radiculopathy by spinal canal stenosis due to spinal degeneration. Then typical symptom is intermittent claudication, pain, and muscle weakness in lower extremity. And more than 100 million patients all over the world suffering this condition. So I would say almost half of patients visiting orthopedic clinic, surgery clinic, is this disease. Then 50 subjects of LSS and healthy control subjects of same number of subjects and age-matched controls we used. Then this is the result of the performance of 80 algorithms. Each blue bar represents each algorithm. Then this is MCC, this is AUC of ROC, this is accuracy. So about MCC, highest is 0.86 and average is 0.639. And AUC of ROC, highest is 0.96 and average is 0.854. Accuracy, highest is 0.93 and average is 0.8. So basically, the performance is quite good. Then this is the result of top 5 algorithms. The kind of machine learning is Bayesian network. Then the selection method of feature is InfoGain. Then MCC is 0.86. AUC of ROC is 0.96. Accuracy is 0.96. And all of the Gait features are selected by InfoGain. Then this is a schema showing the 20 features selected by InfoGain. So this means distance between right elbow and left elbow was used. And for example, this is a right elbow and right knee segment was used. So if you look at those one, the view of lateral one, like sagittal parameters, were used. And joint points, like the points in trunk were the mostly used. And the segments mostly used are between trunk and lower extremity and lower extremity. Because this disease, lumbar spinal stenosis, basically patients, if patients has a typical symptom, patients tend to show forward bent posture like this. And also patient might have a spinal kyphosis, also affect those posture. So this disease condition or typical standing posture or gait posture could affect this result. In the most of the gait feature were in sagittal plane and trunk related. But we don't know, just this is an assumption why those gait features were selected. The next disease condition, we look at the knee osteolysis. Also, this is a very typical condition we see outpatient clinic. So also, this is a major disease to cause knee pain. There are more than 300 million patients all over the world, and disturbs ADL, and also severe condition of this disease, surgery like total knee replacement is required. So the increase of this condition or increases medical cost significantly. That's a big problem in our country. So 94 subjects of knee OA and 15 subjects of healthy controls were tested. And among those knee OA patients, very mild, moderate, severe, all kind stages of patients were used. Also, because it is pretty difficult to find the age-matched healthy controls, because the patients shouldn't have knee OA at all, even though middle or elderly ages. Such a no symptom patients, to find that kind of patient is pretty difficult. That's why this is quite unbalanced data. Then this is a result of performance of AT algorithms. Each blue bar represents the performance of each algorithms. Then AUC of ROC, highest one is 0.9. MCC, highest one is 0.69. And accuracy is highest 0.9. But before I mentioned, MCC is the most reliable parameter in this case, because the data distribution is unbalanced. But still almost 0.7, this result shows. Today, I don't show the data. We also did analysis with with balanced data. Then, because we artificially generated data, then did same result. Then this MCC improved 0.9. But today, just I want to show this raw data. But the compensation by artificial data doesn't necessarily mean increase the accuracy. So we believe this method is quite reliable. Then this is the data result of top 5 algorithms. Then again, AUC of ROC and accuracy is quite high, but MCC is relatively high, I would say. And many kinds of selection of features were used. Then in this case, those are segments used for prediction. Then if you look at the joint bonds, 75% of used joint points were upper extremity, very unlike the LS cases. So the movement of the upper extremity were used. Also segments, segments between upper extremities were used, elbow, the segments between elbow and hand, or hand and shoulder, like that. So this is a disease of knee, but the actually used gait feature were from upper extremity. This is quite an interesting result, we thought. Then literature says the knee OA patient shows lateral trunk tilt like this, and also forward bend posture. So as I said, the selected feature, most of them are upper extremities. So the reason why I assume if subject or if patient shows gait like this, probably those upper extremities move as a compensation. So that's why this, machine learning used the movement of upper extremities. So In other words, upper extremities is more sensitive to show this disorder than lower extremity. So the current system is a combination of the capture of whole body movement with machine learning, and very simple and non-Bayesian system, and use numerous gait features and the data-driven approach. So potential application of this system, we think, is not only medical, but also welfare facility. So include for family medicine, telemedicine, and health check. And this system is quite practical and versatile because simple and non-invasive, and anywhere and anybody can use it with low cost. So we believe this system is applicable to other musculoskeletal disorders as well as neurological disorders and potential disorders related with gait directly or indirectly. So conclusion, machine learning of whole body movement during a gait captured by the depth camera can predict lumbar spinal stenosis and knee osteoarthritis. The present method may contribute to the development of a novel prediction system for musculoskeletal disorders as well as other diseases that affect gait function. So I want to show my thankfulness to those people to contribute to this research by providing us the data, clinical information, as well as technical development and others. Thank you very much for the presentation.